Welcome to BackWords. I'm Dr. Dan Francis. We're here tonight to talk about arthritis. As a chiropractor, it is probably one of the main topics that I talk about. I've done many talks and seminars on this. We've got the human spine here. We've got some models of the degenerative chain. We'll break down arthritis into a couple different models. There are basically two main categories of arthritis, and they are inflammatory and non-inflammatory. And the difference is inflammation, but the categories are bigger in that the inflammatory type would be your rheumatoid, your lupus, your psoriatic type of arthritis. And that arthritis category is basically treated more by medical doctors and medicine. It's an inflammatory type of arthritis. It's a systemic, meaning it's through your body. The type of arthritis we're going to talk about tonight is the non-inflammatory chapter, which is the most common type within our country, and that's the degenerative chain. And the degenerative arthritis is depicted here in these four vertebral models. We're going to talk about other aspects of that also. But in the degenerative chain, what you have is you have arthritis where it's more localized. It's a use and wear. And when I say more localized, it can be one joint, but not throughout the whole body. And that is our main goal here, is to try to educate you on that. Oddly enough, while the two categories say inflammatory and non-inflammatory, the non-inflammatory type of arthritis actually does have inflammation, but that inflammation is going to be localized to an area. Again, it's not going to be systemic throughout the body. So when we talk about arthritis, it's good to talk about what arth means. Arth means joint, and a joint is where two bones meet together. And two bones riding on each other, it's just not really fun. Bone on bone is pretty nasty. So we're created with cartilage, and that cartilage is basically a slippery and a slidey substance that glides and makes the bone so the bone doesn't hit the bone. And that cartilage absorbs water and is sort of spongy. And when you have a nice, healthier joint, it's going to be nice and easy movement. One of the things that happens is that a lot of people are told over time, hey, they told me I had arthritis when I was 20. And technically, they may have been told the right information. But the problem with that is when you're told you have arthritis, if you break the word down, arth meaning joint and itis meaning swelling, well, you may have had some swelling in that joint, but you truly have degenerative arthritis. And that's what I want to differentiate. Just because you have a local joint problem at one time doesn't mean you necessarily are going to have arthritis your whole life in that joint. The degenerative arthritis is much more aggressive, and it affects your ability to move that joint and the function of that joint. So it's real important, this talk, when we talk about the spine, we talk the hips, the knees, and the hands, it's real important for you to understand that this talk really isn't a topic for just elderly. Elderly is when the arthritis a lot of times has settled in so great that you can't do anything more about it to really prevent it. But for those of you who are proactive and see parents who maybe had arthritis or grandparents that have had it, if you can learn a little bit about arthritis tonight, that would make me happy, because it can prevent you a lot of damage in the future. And arthritis is really about early intervention. When we look at the spine, you've got several main sections. You've got the cervical vertebra, the thoracic vertebra, the lumbar vertebra, and that leads into the sacrum, which attaches to the pelvis. And then from there, you've got the femur joint, the ball and socket, attaching in, then obviously the legs going down. The spine is made up of vertebra. Between them are the spongy discs, which are made of a nucleus or a gel surrounded by ligamentous fibers. And you can see that it protects the spinal cord and the spinal nerves coming out. This is a real common area for degenerative arthritis. The main areas of arthritis in the spine are going to be in the lower cervical area. Get my hand out of the way there. In the lower cervical vertebra here. In the thoracic spine, it'll be right at the junctions between the neck and the cervical vertebra. Oftentimes, depending on if someone's had a compression fracture from osteoporosis within the mid-back. And then very common in the low back, especially down in the lower lumbar spine. As you see, the lower lumbar spine, those vertebrae and discs are bigger. They're bigger because they're bearing more weight like a pyramid. And they too are very common areas for having degenerative arthritis. So one of the key things to arthritis is that it comes from two polar opposite things. Degenerative arthritis comes from both overuse and the exact opposite, underuse. You heard it right, underuse. You will have just as much arthritic change by sitting on a couch and doing nothing as you will overusing something. Our bodies are extremely efficient. And if you choose to sit and do no activity, your body is not going to send resources to the bones or to the joint. So if you're not using your hips and not staying active, that hip gets less dense bone and the cartilage isn't getting exercise, so it starts to wither also. And I see that year in and year out. People will come to me and they will have just as much, if not more, wear in their body and their joints from a lack of use as they do from overuse. And the problem with the lack of use is that those joints aren't then flexible at all. At least someone who's overused it has some flexibility and strength in there, where the person who's underused, that joint is going to be sort of withered and contractile. So it's real important to realize that one of the main things you need to do is stay active. It's very, very common for people to say, oh, I have arthritis, so I don't do this or I don't do that. And that is not good advice, and we'll guide you through that a little bit. So the joint is basically where two bones meet, and you've got cartilage, that slippery, slidey substance on the cartilage. And they call it degenerative arthritis. I'll show you more of the hip here. But that hip sliding around, and why they call it degenerative arthritis is because what degenerates is the cartilage. And if that cartilage degenerates, then it gets thinner and thinner, and before you know it, you've got bone riding on bone. And it's much like a wheel on a car. Whether it's the spinal mobility or the mobility within a hip, when your wheel moves properly, the tire moves with it, obviously, and it wears evenly. When your wheel is out of alignment or doesn't have the right motion pattern, then what happens to the tire? It wears improperly. And that's really what the degenerative process is. It's an improper wearing of the joint. You could take a tire off a car and put a new tire on. If that wheel hasn't been balanced, the next tire is going to wear. And that's what a lot of treatments for arthritis do. If they don't correct the motion of that joint, then that person is going to continue the wear process. So it's real important to deal with the function of the joint, no matter what part of the spine or extremity joint it is. As that cartilage breaks down, cartilage, like ligaments and tendons, they're white. They don't get a lot of blood flow. The reason I talk about that is blood flow is key to the ability of an area to heal. The bone, while it looks white, is actually highly saturated with blood and has a lot of blood flow in there. So areas that don't get a lot of blood aren't going to heal as well. So when you get a wearing of the cartilage, your ability to build that cartilage up and keep it healthy again is diminished quite a bit. So that's an important factor for us, is that we don't want to see the joint wear, because you really can't get those thicknesses in the joint back. That's not very much of an option. So very important for us to see that process catch that early, because that makes a big difference. The main areas that we see are the degenerative arthritic process in the body. Aside from the spine, the three main areas are going to be the hip, the knee, and the hands. Of them, the thumb, right here, okay, that joint is the most commonly arthritic joint in the human body. And you think about it, go for a day without using your thumb. Okay, it really is, the opposable thumb really makes all the difference in the world. And when that happens, you can see the thumb sort of tuck in like this. It gets very difficult to grip, very difficult. You'll see the muscle atrophy. And the other problem with arthritis is our body is almost to a fault good at hiding this arthritic process. If we look at the spine here, this is a normal healthy disc. The first stage of a healthy disc becoming unhealthy is that when it hasn't moved enough, that disc starts to lose its vitality. It's not moving quite as well. And then you go to the next phase where the disc is still moving pretty good. Patient or the person doesn't really have many signs or symptoms. Almost to a fault, the body hides the pain. As a result, though, you can see that the disc has narrowed. Okay, if that disc has narrowed, that means, well, we'll go to this side here. If that disc has narrowed, that means there's going to be less space for that nerve to come out, which means you're more likely to compromise that nerve. Bending down, twisting, all of a sudden your back goes out. So when you start to see that slow and steady, you may not feel pain right away, but you're getting closer and closer to that status. The next process is where you have more degenerative spurs. And these osteophytes, they're often called. You can look at them. Now the disc has thinned even more. And in a severe case of arthritis, the osteophytes will also grow back here in what we call the foramen. The foramen is the hole where the nerve comes out. When those nerves go back there, again, amazingly so, you cannot have pain back there. You can, but you cannot have pain. In fact, if the spur itself were causing the pain, then I wouldn't be able to treat anyone with degenerative arthritis, because they'd always be in pain because the spurs don't go anywhere. But in this process, you can see the spurs are trying to fuse things together. And from there, you go to a very severely degenerative joint. Now, these people can have varying amounts of pain from extreme to none, but they're definitely going to be stiff and having lost some motion. So we're going to take a quick break, and when we come back, we're going to talk a little bit more about the degenerative model. We're also going to look at the diagnostic end, looking at the x-rays, and so you can see what an x-ray looks like of both degenerative arthritic spurs in the hip, and we'll talk about the treatment options. We're talking back, and we are talking fish oil. Why fish oil for the back? Because many people say, how can I help inflammation? And if there's one way to stop inflammation that's natural, fish oil is it. And fish oil has omega-3 fatty acids in it that are very helpful in the inflammatory process. And somebody with spine pain often has inflammation. It's great for your cardiovascular system. It's a wonderful nutrient. It's a supplement in your diet. But if you can keep your inflammation down, oftentimes you can keep checks on your back pain and really reduce how much medicine you have to take. And if you can do that, you reduce side effects. Of course, you have to not be allergic to fish oil, and it's a great supplement for multiple aspects of the body. We'll be right back. Welcome back. We're in my office now. We're going to look at some x-rays here. What our goal here is when I took these pictures, we were looking for whether there were some arthritic processes going on in the body. And we look up here, and these two x-rays are the same individual. And this x-ray was taken 6 months earlier than this x-ray. The person was complaining of hip pain. And this is exactly what a hip should look like. nice and round femur joint. You can see that red line I was showing her, that it's nice and evenly spaced. And that acetabular joint looks perfect. She was about 55 years old at that time. And she was treated, did okay, but about 6 months later came back and just had severe pain in the hip, a couple weeks of treatment, and nothing really improved in there. So we decided, well, maybe it's worth taking another x-ray. And we went back, and here's her hip 6 months later. This is a classic x-ray of a severely degenerated hip. You can now see there's no space in that joint. You can see that that hip is sort of buckled or mushroomed out over there. It doesn't fit in that ball and socket joint like the other side does. If you look at that other side, it's sitting nice and smooth. There's a gap there. That's a beautiful hip. But this hip has become bone on bone. She could barely move. And you can see there's no more cartilage in there. Not only that, but now the bone is being compromised, and we don't worry about that so much on this, because if she has to have a hip replacement, they're going to take that portion out. But you sure don't want the socket to lose its patency. And when that does, it just becomes a more difficult surgery. So really what this gal was looking at is in a 6-month time frame, she actually went from a hip that on x-ray looked good, but it really wasn't, and it was in the process of degenerating, and it degenerated really quick. This isn't necessarily the norm, but it is obviously able to happen. And so this gal, for full resolution of her problem, she had to have a hip replacement done. We had to send her to an orthopedic surgeon, and because it was dealt with early, she was able to get back and do all the lifestyle things. She's a very active person with golfing and tennis, all that kind of thing. So she was able to get back into her lifestyle activities. And it was important, if she wanted to hang out with this and not let this, have this surgery, the longer she's on an arthritic hip like this, you know what's making up for it? The good hip. And before you know it, you're having a second arthritis done. So it's real important when you have an arthritic hip or knee, if it's something that is replaceable, there's a point in time where the most conservative thing to do is actually to have the surgery. So that's obviously a discussion for the patient and the surgeon, but it's my job as a chiropractor when it's something that I can't treat to get them to the right people. And this was one of those cases. Now this is a different x-ray. This is of the low back. This is the lumbar spine. It looks very similar, but I did get this gentleman's hips in there, and he's 84 in perfect hip health. He's not going to have a hip replacement. But his spine, if we're looking at these models here, his spine sits on that far one. Okay, and the reason I chose this x-ray is you can see he has a very prolific bone growth. You can see not only these are growing and they're aggressive, but these are huge. Okay, the space between his second and third and his the first and the second and the third vertebra, those vertebrae have actually fused with bone spurs, and so he doesn't have any motion between those two vertebrae anymore. Now between the third and the fourth and the fourth and the fifth, and between L5 and the sacrum, those still exist, little gaps, even though the spurs are there. And because of that, we can adjust him and we can get motion in there and keep that that segment useful. And so if you do that, you're not going to swell that joint back up and get the disc all big and healthy again, but you could keep it from getting to where it's fused and allow him still to have motion. And that's important because when we look at this, here's a side view of that gentleman. From the side view, you can see that it's very hard to see what would be his discs. That's the space where his disc would be. And there's just nothing there. There's not much there, not much there, not much there. It should be much thicker. And the amazing part about it is this gentleman doesn't have active daily pain. He'll have pain now and again, but he still doesn't have active pain. So one thing that's well documented is that as useful as radiographs are in helping diagnose arthritis, it doesn't correlate. How bad an x-ray looks doesn't correlate with the pain level. That goes for the hip too, but a little less so than with the spine. Usually when you get bone on bone in the hip to that degree, that person's going to have significant pain and mechanical issues. In the spine, this degenerative process happens so slow it's like watching grass grow. And the people don't even know they're losing mobility and losing the effectiveness of that joint. Because the joint degrades so slow, well, when that happens, it happens slow, so what they get is the nerve starts to shrink and accommodates the smaller hole size. And as a result, they'll start to get a wider stance and not move as well, but it doesn't necessarily mean they're going to have pain. Now, they're more likely to have pain. They're more likely to do something minor that's going to cause them pain, but it doesn't necessarily mean they're going to be in active pain. Now, some of the main things we do to deal with arthritis, first and foremost, is motion. The person needs to move. That's why yoga and walking and stretching, they're so beneficial, because when you're moving your joints, you're allowing the blood flow to come in and out. So as you move this vertebra, think of the disc like a sponge. You could think of the cartilage in your hands like a sponge. As they're moving, the bad fluid's going out, the good nutritious fluid is coming in. That allows for the restoration of the joint and the blood flow and the oxygen you need so that the joint stays healthy and can repair itself. So motion is vital. As a chiropractor, that's what we do. We're trying to correct the mechanics of the joint so it moves properly. We're trying to get the pressure off the nervous system so that you're not having pain. But that's the main thing that we're trying to accomplish when we adjust someone with an arthritic area, is to keep the body moving, because we realize if the body is moving, it's going to be less likely to deteriorate at a faster rate, and it's also going to be more ample to heal itself and minimize the future damage. In these more arthritic situations, these joints, once they fuse, I can't move that. Once you fuse a joint, you can't move it anymore. So it's real important. When I find somebody who's got an early arthritic process where the spur is just starting to form, I try to make them understand that this is a perfect time to treat it. You don't have to act arthritic. The key is to keep moving and keep it active. And when you do so, that makes a world of difference in the health of the joint and your health overall. We've mentioned this before, but if you're not moving, you're not going to be healthy. If you're not moving, your inner organs aren't getting exercise, the blood flow's not going through them, and your general health deteriorates. It's easy to see. You can look at any elderly person. The more active they are, the more vital they are, the more color they have, and it's how their life stays in good merits. So there are several things you can do. What I have here, there are some nutritional components to arthritis. There's several things you can take from a natural standpoint. This little white pill is a pill called glucosamine sulfate. Now, I think it's up to you and your physician, whoever you see, your healthcare provider, to determine what options are best for you. But we have a lot of success with glucosamine sulfate. We use just glucosamine sulfate. We don't use any of the combinations. Glucosamine sulfate is little stuff. It's from a shellfish, so it's definitely contraindicated in somebody who's allergic to shellfish. But it absorbs into the body, and what the glucosamine does is when it absorbs, it makes up the matrix of the cartilage. So it's like the matrix of a sponge. And if you have that matrix in there, then the water is going to be attracted to it. That's what gives you the shock absorption. And while glucosamine sulfate won't build up the joint, it can really slow down the process of the degradation and give a lot of discomfort relief and pain relief in there and help function quite a bit. So it's been around for a while, and it works quite well. We find that couples very well with fish oil. And I have a couple fish oil tablets in my hand just to show you. This is your typical fish oil capsule. Fish oil capsule is about 1,000 milligrams or 1 gram. This is more of a child's dose or a smaller dose for someone who can't handle it, can't smell it because we're on TV, but that's a strawberry flavor that's smelling up the room here. Some people can't, they burp up fish oil, so there are all kinds of flavored varieties so you don't have that fish oil taste. But why fish oil for arthritis? Because fish oil is just a phenomenal anti-inflammatory. And because in degenerative arthritis there is local inflammation, if you take fish oil on a regular basis, it can be wonderful at reducing your inflammation rates and helping that joint survive. The other things that can be helpful are other natural anti-inflammatories that can help both the spine and the hip and the knees, any area in the body. Some of those are turmeric. We use one called bromelain, which is an enzyme from the core of a pineapple. That's a class called proteolytic enzyme. When taken on an empty stomach, it does a wonderful job at breaking down inflammation. But there are other things like boswellia, which is the herb frankincense, that also modulates pain. So there are a lot of natural options out there, and we do look for natural options because most of the natural options won't have too many side effects. You have to look at your allergies to certain things like fish or shellfish. But it's important to talk those options out with your doctor, because if you can stay off of being on medication for a long time, you can reduce how many side effects you have from the types of medications that are out there. Great short term, not necessarily long term. Again, those are discussions for you and your physician. But as far as arthritis goes, remember, you want to keep moving. You need to stay active with it. And the last thing is you have to eat a diet that's non-inflammatory, and that means not a lot of processed foods, because that, again, keeps the inflammation down. So you are what you eat, and it affects your body in many, many different ways. That is our segment on arthritis tonight. I hope you learned something about it. As always, feel free to contact me on the web with any questions, but we're glad you joined us, and until next time, we've got your back.